How does diverticulitis lead to an enterocutaneous fistula? Imagine a small pouch forming in the wall of your colon. When these pouches, called diverticula, become inflamed or infected, it's known as diverticulitis. This condition can sometimes cause serious complications, including the development of an enterocutaneous fistula. But how does that happen? Let's break it down. When diverticulitis becomes complicated, it often leads to the formation of an abscess, which is a pocket of pus caused by infection. This abscess forms near the affected diverticulum as the body tries to contain the infection. Over time, if the abscess enlarges or isn't treated effectively, it can weaken the surrounding tissues, including the wall of the colon. As the infection persists, the abscess may rupture or erode through the colon wall. This erosion can extend into nearby tissues, such as the abdominal wall or skin. When this happens, an abnormal channel or passageway begins to develop. This channel, lined by tissue that tries to heal but often remains open, connects the inside of the colon directly to the skin surface. This is what we call an enterocutaneous fistula. This fistula allows contents from the intestine, including bacteria, food particles, and waste, to pass through the opening in the skin. This can lead to continuous drainage, skin irritation, and increased risk of infection. Sometimes these fistulas form spontaneously because of the ongoing inflammation, but they can also develop after surgical procedures or abscess drainage aimed at treating diverticulitis. The process involves several steps. First, the inflammation causes tissue damage and abscess formation. Then, the abscess extends or ruptures, eroding through the colon wall and into the surrounding tissues. Next, a tract begins to form, creating a direct connection between the colon and the skin. If this connection doesn't heal, it becomes a persistent fistula, often requiring medical or surgical intervention. While enterocutaneous fistulas are less common than other types of fistulas related to diverticulitis, they are serious complications. They reflected advanced disease and need careful management. Treatment usually involves controlling infection, maintaining nutrition, and often surgery to close the fistula and repair the affected tissues. In summary, diverticulitis can lead to an enterocutaneous fistula through a process where infection causes an abscess that erodes through the colon wall and nearby tissues, creating an abnormal passage to the skin. This complication highlights the importance of early detection and proper treatment of diverticulitis to prevent such serious outcomes. Always consult with healthcare professionals for personalized care and management options.